Hi, my name is Olivia, and my research looks at optical flow perturbations and the effects on standing balance in people with multiple sclerosis. Multiple sclerosis is a progressive chronic disease that affects 2.5 million people by obstructing nerve signals. Mobility and balance can be impaired in patients with multiple sclerosis, making daily fundamental tasks more challenging. The purpose of the study is to examine the effects of visual perturbations on standing balance in patients with MS. We had two hypotheses in the study. We first hypothesized that visual perturbations would affect standing balance in patients with MS more than the control subjects. Secondly, we hypothesized that standing balance would respond more to anterior-posterior perturbations than medial-lateral perturbations in patients with MS. Our methods including taking 14 patients with MS and 14 aged mask control subjects that stood on a force plate under four 1-minute virtual reality conditions. These conditions included medial lateral perturbations, anterior posterior perturbations, eyes closed with no perturbations, and eyes open. These continuous perturbations elicit the visual perception of instability. Markers were placed on each participant with emphasis on C7 and sacrum to monitor sway. We calculated standard deviation and range of center of pressure and ran repeated measures ANOVA with post hoc pairwise comparisons. Compared to the medial-lateral perturbations, anterior-posterior perturbations more greatly impacted all subjects' medial-lateral range and standard deviation of center of pressure compared to the eyes open control trial. Our first hypothesis was not supported. Since perturbations did not affect standing balance in patients with more than the controls, possibly because the patients with MS were young and relatively fit. The average age was 38.9 years with a preferred walking speed of 1.29 meters per second. Prior research suggests that optical flow perturbations better reveal balance deficits in patients with MS during walking than during standing. We interpret these findings that patients with MS rely more on vision during walking than standing balance. Our second hypothesis was supported, as medial-lateral range and standard deviation were higher during anterior-posterior perturbations. We weren't expecting was anterior-posterior perturbations, standard deviation and range to differ between anterior-posterior perturbations and any other condition. In the anterior-posterior direction, the base of support is much smaller, and patients might prioritize strategies to limit variability with the perturbations. These limits, combined with prior research, implies that in a clinical setting, perturbed walking might more greatly detect balance deficits and falls in patients with MS. Figure 2 is MS subject 3, a representative subject in the study. Based on this figure, we concluded that optical flow perturbations cause greater variability in respective direction. Overall, these findings have clinical implications of screening of patients with MS detects followers impaired balance.